Several EMS systems in the Bay Area are starting to feel the pinch of rising COVID-19 cases. Some ambulances are having longer wait times or diverting patients to other hospitals because ERs are full. As 10 Tampa Bay's Adoria Chumba shows you, smaller rapid response teams are trying to work around this in Sarasota County.
Emergency call volumes and ambulance transports are up overall in Sarasota County, not only for COVID-19 related calls, but also for normal calls as well.
This is an older community, so we have, stroke and cardiac arrests and, heart attacks and all of those things that we continue to run every day.
While Sarasota County Fire Department doesn't classify calls as COVID-19, paramedics and EMTs are reporting around 16% of EMS calls are for flu-like or COVID-19 related symptoms. Assistant Fire Chief Carson Sanders says that's around 45 to 50 calls a day.
We not only have that high peak season type volume, but we also have this rise in COVID, and all the hospitals are fully open. They're taking patients. A lot of people are going into the waiting rooms themselves.
The county's rapid response teams, made up of 2 responders in a smaller truck, is now handling many of the lower level calls that don't need ambulance service to avoid straining hospitals.
Whether that was a mental health referral, whether that was having them check with their doctors, any of that kind of thing that we could do where we could help them at home and not necessarily have them transported.
Sanders says the steady rise, which began 3 weeks ago when such calls were just at 6%, is straining EMS systems and impacting workers.
A first responder, firefighter, paramedic, EMT, I think everybody has been just kind of worked to death with COVID.
Additionally, the first responders aren't just dealing with the stress brought on by the jump in calls. They're also concerned about keeping themselves protected from contracting COVID-19 while on the job.